Hello guys, welcome and welcome to Metier Academy, one of the leading academy in training nurses and the nursing competitive exam as well as IELTS and CLEX and OET training. Welcome back to Magic Pill session. Today the topic what we are going to discuss is crutch walking. Already part 1 video related to crutch walking. It is streaming in YouTube channel and this is part 2 video, and in part 1 video we have covered the important topics or the previous year questions whatever asked related to crutch we have covered in the part 1 video, and in this part 2 video we are going to cover the gates, that is 2-point gate, 3-point gate, 4-point gate, swing through gate, each and every topic with video demonstration I'm going to cover in this video. So those who are going for skill examination, like now the JIPMER skill examination is going to happen. So those who are going for skill examination, please watch the video. This one is going to be very much useful for you. Okay, those who doesn't watch part 1, please watch part 1 also, and this is part 2 video. Okay guys, so let's begin the session with a motivational start, means quote. Let's start the session. The greatest pleasure in life is doing what people say you cannot do. If the people is saying you cannot do, just prove to them you can do it. Okay. So with this thought, let's start the session. See, I'm going to start from the beginning itself. I'm going to start with a video demonstration only, because those who are going for skill examination, video demonstration, they will be giving the crutch to you and they will ask you to walk with the help of the gate, with the help of the crutch. They will ask you the question, demonstrate 2-point gate, demonstrate swing gate, demonstrate 3-point gate. That time you have to do the demonstration. Okay, so related to this only the questions will be there for you. Okay, so this demonstration video is going to be very much useful for you. Okay, let's start with the 2-point demonstration, 2-point gate demonstration video. Okay, here you can see this is the 2-point gate demonstration. First see, after that I will explain. See the crutch as well as see the foot, how they are walking. The crutch and the foot is moving simultaneously. This is the key point you have to keep in mind. The foot and the crutch is moving simultaneously. Normally how we will walk? While we are keeping our left leg forward, we will move our right hand forward. Okay, while we are moving our left leg forward, we will move our right hand forward, right? The same way in 2-point gate also, the person is moving the left leg and moving the right hand along with the crutch. Otherwise, if the person is moving the right leg, and the person will simultaneously moving the left hand along with the crutch. So right hand and left crutch moving simultaneously. Left leg and right hand crutch moving simultaneously. Moving simultaneously, that is the key point. Okay, mostly students will get doubt in 2-point gate and 4-point gate. Okay, see 2-point gate, one leg and one crutch, opposite crutch is moving simultaneously. That is called as what? 2-point gate. That's it. One leg, for example, left leg means the opposite right hand crutch is moving simultaneously. That is called as what? 2-point gate. Okay. But in 4-point gate, 4 times the person will keep the crutch as well as leg in the ground. I will show that in the next video. But now you have to know what is 2-point gate. The leg and the opposite hand crutch will move simultaneously. That simultaneously word is the key point. Okay, once again I will show the video, watch it. So here right leg and left crutch is moving simultaneously. Now left leg and right crutch is moving simultaneously. Okay, so one leg and one crutch is moving simultaneously. You can see very clearly here. Yes. So once again, I will show, because this is very, very important, guys. Okay. Opposite limbs are moving together. Okay. Right leg, left crutch. Left leg, right crutch. Moving simultaneously. Okay. Fine. So this is called as what? 2-point gate. Hope you would have understand the concept now very clearly. Okay. So now what we are going to see is, now we are going to see the other type of gate. Firstly, I would like to show you 4-point gate. Already I have discussed or I have shown the demonstration video of 2-point gate. Now I am going to show you the 4-point gate, because mostly students will get doubt in between 2-point gait and 4-point gait. Okay, so in 2-point gait, the word simultaneous is very important. Simultaneously, opposite limbs are moving together. That is 2-point gait. But in 4-point gait, it is totally different. Let's watch the video so that it will be easy for you to understand. So one crutch, opposite leg, another crutch, another leg. So 4 times there is a touching in the ground. Okay. See, once again I will repeat. Crutch, leg, again crutch, again leg. Crutch, leg, crutch, leg. Understand what I am saying? Yes. Crutch, leg, again crutch, leg. So this is called as what? 4 points. So 4 point is they are moving 4 times. They are moving 4 times. The movement in the body is 4 times. The movement in the body is 4 times. That is called as what? 4-point gait. Once again, I will show the video. Listen carefully. Now the person is standing in the tripod position. In the last video in part 1, I have explained very clearly about the tripod position, how to place the crutch. Okay, so in how much inches away from the body we have to keep the crutch, or how much centimeter away from the body we have to keep the crutch. If you are keeping the crutch, it should come in a tripod position. Okay, all those concepts I have covered in part 1. So watch the video, watch that video also. Okay, so once again I will repeat the 4-point gait. Listen carefully. Yes, crutch, look at my finger, legs, again crutch, again legs. 4-point is over. This is called as 4-point gait. Clear, guys? Yes, crutch, leg, crutch, leg. So now you are going to see the 3-point gait. What gait? 3-point gait. Very important, related to 3-point gait. So many times they have asked the questions. Okay, fine. See here, let's see how they are moving. Yes. Now see, first they are keeping forward the crutch and then moving the unaffected leg and then unaffected leg. Once again, I will repeat. Crutch and crutch, they are keeping forward. While keeping the crutch forward, they are moving the affected leg also along with the crutch. Crutch and unaffected leg. Crutch and affected leg is moving forward. After that, they are keeping the unaffected leg. Crutch and affected leg first moving forward. Afterwards, they are keeping the unaffected leg. Okay, let's see here. Yes. Crutch and affected leg is moving forward and then strong leg. Crutch and affected leg moving forward and then strong leg. Okay, so that is called as what? 3-point gait. And now this is swing through gait. Very simple. So first crutch, after that legs together. The legs is moving together. So first they are keeping the crutch and then they are moving their legs together. Okay, so first keeping the crutch and then they are moving the legs together. This is called as what? Swing through gait. Okay, the next thing is while climbing the steps, first unaffected leg, then crutch. Unaffected leg, then crutch. Okay, so see, unaffected leg, then crutch. Unaffected leg, then crutch. This is how you have to climb the steps. While getting down, first you have to keep the crutch and then you have to keep the unaffected leg. First keep the crutch, move forward and then keep the unaffected leg. Look at the video carefully. And now while sitting, so this is the affected leg, this is the unaffected leg. We have to keep both the crutches parallelly in the side of affected leg. Where we have to keep the crutches? We have to keep the crutches in the affected side and with the support we have to sit. Okay, and while getting up also in the same position, the crutch has to be kept in the affected side. Okay, and with the support the person has to get up. Okay, fine guys. So these are all the important video demonstration you're supposed to know. Okay, before discussing about the gaits, 2-point gait, 3-point gait or whatever gait it is, you should know about all these steps. Okay, if you have any confusion, rewind the video and watch again and again till you are getting the clarity. Okay, so whatever the question which is asked related to gait, now we are going to solve it. Okay, fine. So the first question, scenario based question, what we are going to discuss related to gait is a 17-year-old client admitted in the emergency ward with the left femur fracture. See, always you know that we have to find out the key point, right? So here left femur fracture is there. Okay, the fracture is reduced and plaster is applied. So means the fracture is treated. Okay, now the healthcare provider advised not to bear the weight on the affected area or affected leg. Not to bear the weight on the affected leg. This is the key point you're supposed to note down. Okay, left leg fracture. So the doctor is advising the patient not to bear the weight in the affected leg. Clear? Yes. So now which crutch walking gait is suitable for the patient? Just close your eyes and imagine. Just now I have shown all the demonstration videos. In the 2-point gait, the two legs are kept on the ground. The two legs are touching over the ground. Yes or no? In 4-point gait, again, the two legs is touching over the ground. In swing through gait, again, the two legs are touching over the ground. It means that affected leg and unaffected leg both are coming in contact with the ground. Yes or no? Yes. So affected leg and unaffected leg both are bearing the weight. Even though the unaffected leg is bearing more weight when compared to the affected leg, but still both the legs are bearing the weight. Yes or no? Yes. Fine. But in 3-point gait, it is not happening like that. If the left leg is affected, means the person is going to bend the left leg and the strongest leg is going to come in contact with the ground. Yes or no? Yes. So here you can see the answer is going to be 3-point gait. Why the answer is 3-point gait? In 3-point gait, you can look at this video, image. It will be clearly saying why this answer I have selected. So here the left leg is affected for the patient and doctor is advising the left leg. In the left leg, the weight bearing should not be done. Okay, so this patient is going to bend the left leg. Okay, and in the strong leg, the total weight is going to be there. Okay, so in the crutch as well as in the strong leg, the weight is going to be distributed equally. Okay, so what gait is this? This is 3-point gait. Why I am saying 3-point? So this is 1 point, this is 2 point, and this is 3 point. Only 3 point is touching the ground. That's why it is called as what? 3-point gait. Okay, guys, fine. So for this question, which is the right answer? Option C, that is 3-point gait. Okay, so the next question is, a nurse is observing a client with the crutch walking. So a nurse, she is observing the client and the client is doing the crutch walking. He moved forward both the crutches. Understand the concept? He moved forward both the crutches and one injured leg. So 2 crutches kept forward. At the same time, injured leg also moved forward. Along with the crutch, the injured leg is also moving forward. Understand the concept? Along with the crutch, the injured leg is also moving forward. Okay. And then the stronger leg is coming forward. Okay. So first, crutch and affected leg is moving forward together. After that, the strong leg is coming forward. Okay. So the client is ambulated by using what type of gait? This is the question. So let's see. Same 2-point gait, 3-point gait, swing through gait, and 4-point gait. Just assume that here what they are saying, the crutch is moving forwards. At the same time, the affected leg is also moving forward simultaneously. And the last, which one is coming forward? The strong leg is coming forward in the last. Okay, so what type of gait is this? It is 3-point gait. Okay, so 3-point gait only. The affected leg and crutch will move forward first and then the strong leg will come forward. Okay, so here which is the right answer? 3-point gait. Clear, guys? The next question, in which point gait the affected leg bear body weight? Actually, it is except question. It is except question. I forgot to add except. Okay, just add except. I forgot to add except here. Please add except. It is the except question. This question asked in NORCET examination. In which point gait the affected leg bear body weight except? Okay, so it is a except question. So 4 options they have given here. Understand the question properly. The affected leg, bear, body, weight, except. Okay. So in just close your eyes and imagine in 2-point gait, affected leg and unaffected leg both is coming in contact with the ground. Okay. And in 4-point gait, again, 2 legs are coming in contact with the ground. In swing through gait also, 2 legs are coming in contact with the ground. Okay. But in 3-point gait only, the affected leg is not bearing any weight. Okay. As I mentioned, it is a except question. Okay. So here the right answer is going to be what? 3-point gait. Okay. In 3-point gait, the affected leg is not going to get any weight. Okay. Fine. So the next question is, which of the following is due to improper usage of crutch? Improper usage of crutch. If you are not using the crutch properly, as you all know that 5 centimeter gap should be there in between the axilla and the crutch pad. Okay, otherwise 2 to 3 fingers gap should be there in between the axilla and the crutch pad. While you are holding the hand grip, your flexion, elbow flexion should be there in between 20 to 30 degree angle, right? And while you are keeping the crutch, it should be in tripod position. Okay, so all these things you have to teach to the patient. Okay, so if the patient is not at all following these proper techniques, what will happen? Okay, so this is the question. Let's see what all the options they have given here. Hunching shoulder, stupor shoulder, looking downward during walking, all of the above. Okay, see, let me show the image and I will explain. If they are not using the proper technique of holding the crutch, what problem will happen to the patient? So this is the question, and here the answer is going to be all of the above. Hunching shoulder, stooping shoulder, looking downward during walking, everything will happen. First, you should know what is meant by hunching shoulder and stooping shoulder. Here you can see this is the hunching shoulder. Here the neck is moved forward. The neck is moved forward. Okay. So this is called as what? Hunched shoulder. Okay. The shoulder, from the shoulder, the cervical bone, you can see here there is a curvature. Right. So this is called as what? Hunched shoulder. Stooping shoulder means here you can see the C-shaped curvature in 2 parts of the backside. Okay, so in the neck region as well as in the sacral region, there is a curvature. You can see the curvature here. Okay, so this type of curvature is that means it is like a stooped posture. Okay, hunched posture, stooped posture. Okay, so hunched posture might be there or stooped posture might be there, or while walking they will be looking down like this. Okay, so all these things will be there if they are using improper technique of while using the crutches. Okay, guys. So here the right answer is what? All of the above. The next question is, which of the following is a slow and stable gait? Correct gait. So 2-point gait, 3-point gait, 4-point gait, or swing through gait. So these are all the 4 options. Among these 4 options, which is the slow and stable gait? This is the question. Okay. So here the right answer is going to be the slow and stable gait is 4-point gait. What is that? 4-point gait. Why it is called as 4-point gait? Already we discussed. First, this is the normal tripod position. The person is holding the crutch and standing in a tripod position. And first, the person is moving the crutch forward, right crutch forward, and then left leg, and then left crutch, and the last one is right leg. So 4 times there is a movement in the body, and slowly one by one he is keeping. First he is keeping the left crutch, and then right leg, and then right crutch, and then left leg. So 4 times the body part as well as the crutch together, 4 times touching the ground. Okay, so this is called as what? 4-point gait. Clear, guys? Yes. So these are all the questions, important questions, repeatedly asked questions so far asked in the examination. As I mentioned already, please, all the demonstration video, please rewind and watch it again and again. If you are having any confusion, still you are having any doubts, means you can drop your message in the comment section, guys. Okay. So we'll be solving the doubts then and there. Okay. So fine. So please keep on watching the channel and support us. And all the topics, whatever we are discussing, are very important topics. And not only we are discussing the previous year question paper, we are also discussing additional golden points, whichever related to the questions. Okay. So watch the video. And if you like the video, please like it, share it, and subscribe the channel, guys. Okay. So thank you very much.